Hi everyone, welcome to Dr. Deepa's Learning Launch. I am Dr. Deepa and I'm here to discuss a very interesting case in cytology, which is papillary thyroid carcinoma, which comes under category 6 of thyroid Bethesda reporting because it is malignant. So whenever you're seeing it in a low power, you will be able to see the central fibrovascular core that is very much visible in this image. So you're seeing this orangish area. This is the central fibrovascular core around which you're able to see this arborizing network. This arborizing network that you're able to see around it is also classical of a PTC. So this arborizing network basically has cells that are more towards the periphery than towards the center. So that is also a classic feature of PTC in which you have this arborizing pattern of PTC cells that are distributed around the fibrovascular core. And you will be able to see this in your low power itself. Next image, you are able to see this cell in the center. Let me just pull up the pen so that I can. So yeah, I was talking to you about this particular cell. You're able to see here, and you're able to see that there is a central pale area. That central pale area is basically a pseudo-inclusion, nuclear pseudo-inclusion, which happens because the nuclear membrane is grown over and way beyond the nucleoplasm. So that's the reason why it dips like a bag. So when you have a water bag and you drop it, there's a depression in the center, right? Because it dips into the nucleoplasm. So that is a nuclear pseudo-inclusion. It is not a true inclusion. Sometimes you can also see some Samoma body-like areas somewhere here, which is not very classical in this image, but yes, you can see those Samoma bodies also in PTC. The diagnosis of PTC, although you can get a clue on the presence of an arborizing pattern that I showed you in the first image, but the final diagnosis should be made only after you look at the nuclear features in a higher magnification. If you are given a PAP image also, you can find a similar pattern in which you can see that there is anisonucleosis. If you're able to see this image, then you can clearly say that there is some amount of anisonucleosis. To see this nucleus is much bigger than its neighbor that is here. So there is clearly an isonucleosis, and you're able to see these cells. These are called the nuclear grooves. So you will find these nuclear grooves in many cells. So that and also some of the cells are showing some pseudo inclusions. Not very clear as the previous one we showed, but this one does have nuclear inclusion. So these are the essential features. So when you're evaluating some FNAC smear for PTC, remember that there will be an arborizing pattern around the fibrovascular core at a low magnification. You will definitely see nuclear clearing. You will also be able to see nuclear pseudo-inclusions and groups. So these together will give you a confidence to report it as PTC, and it has to be reported as Bethesda category 6 malignant PTC. Okay, thank you so much. And if you stay tuned to www.drdeepa's Learning Launch for more such details, and we will be sharing many such cases with you. This is Dr. Deepa signing off today. Bye bye.